We are pleased to have each of you join us today. Just as a matter of housekeeping, I do want to ask that as you join and participate on today's webinar, that you please keep your devices muted, just out of respect for today's presenter. We have a great presentation lined up, but before I introduce our guest presenter, let me take a few seconds to just tell you about 1890 Research and Extension. As part of the land grant mission for South Carolina State University, which is to improve the quality of life through research, teaching, and education, 1890 Research and Extension provides programs, services, and activities through which the university is actually able to carry out that mission. And so we do that under the umbrella of 5 programmatic areas. That's 4-H youth and development, sustainable agriculture and natural resources, family nutrition and health, education, innovation support, and community and economic development. So that's our extension side of the house. We also conduct research that seeks to identify solutions impacting South Carolina. So we have projects that look at ways to reduce obesity and obesity-related diseases. We're trying to look at ways to ensure food security through methods of tracing technology that traces food throughout the food supply chain. We're looking at ways to improve agritourism marketing in South Carolina. So those are just some of the projects that we have going on. We have about 22, I think, in our portfolio. So as I'm talking about research, this just brings me to the point where I'd like to introduce our presenter today, because he is one of our faculty researchers with 1890 Research and Extension. Dr. DeMarcus Bush is an assistant professor of audiology here at South Carolina State University. He is the past vice president of audiology for the South Carolina Speech Language Hearing Association, and has been an active member of the American Speech Language Hearing Association for 12 years. Here at 1890, he is conducting an extensive research project that seeks to educate rural farmers in South Carolina about the risks that are associated with loud noises on their farms and how hearing loss may be linked to high blood pressure. So as we recognize October as National Protect Your Hearing Month, I am pleased to introduce to you Dr. DeMarcus Bush.
Hello, everyone. I'll go ahead and share my screen here. Hello, everyone. My name is DeMarcus Bush. I am a National Board Certified Audiologist here at South Carolina State University. And today we'll discuss better hearing and better health. But more specifically, we'll discuss hearing health and also heart health as well. Historically, noise exposure has been considered an occupational hazard, more commonly in the industrial or manufacturing setting. But more recently, farmers and agricultural workers have also been included in this type of area. We know that it contributes to ischemic heart disease and also high blood pressure. Ischemic heart disease is basically the inadequate blood supply to a local area due to blockage of blood vessels supplying the area. The term ischemic means that an organ is not getting enough blood and oxygen or oxygenated blood. Hypertension, which we commonly call high blood pressure, has been a major risk factor for African Americans and also a precursor for TIAs or mini strokes which are strokes that last for minutes, and also CVA, cerebral vascular accidents or strokes. Now, the overall goal of this program was to simply to provide training and education that related to hearing health and also high blood pressure. Another goal was to simply encourage farmers to use hearing protection devices during their daily duties or activities on their farms. And another major goal was to simply to provide techniques for usage of hearing protection devices. So now we're going to switch gears. We're going to talk all about hearing health. Some of the statistics regarding hearing loss, approximately 15% of American adults, 37.5 million, report some trouble hearing. Age has been the strongest predictor of hearing loss. Men are twice as likely as women to have hearing loss. And typically that's due to lifestyles such as hunting, military service, or working in noisy work environments. Non-Hispanic white adults are more likely than adults in other racial ethnic groups to have hearing loss. And another interesting statistic is that non-Hispanic Black adults have the lowest prevalence of hearing loss. Now, I've often wondered in African Americans if African Americans have the lowest prevalence of hearing loss because they do not have access to healthcare or access that covers hearing evaluations and hearing aids. So even with the recent pandemic, the evidence shows that African Americans have poor access to healthcare. Some of the common causes of hearing loss can be heredity, such as like Usher syndrome or Treacher-Collins syndromes, traumatic brain injury or ear injuries, infection disease, such as like German measles, CMV or cytomegalovirus, among others. Some other common causes are tumors or poor circulation. Some medications include like large doses of aspirin or NSAIDs or non-steroidal anti-inflammatory drugs like ibuprofen or naproxen, and also certain antibiotics which end in mycin like neomycin, streptomycin, and also gentamicin. The last two are normal aging process. We like to call it age-related hearing loss, which we term it as presbycusis. And finally, noise exposure. Now, the previous slide highlighted noise exposure. Noise-induced hearing loss is a result of exposure to high levels of noise. The one thing about hearing loss is that it does not discriminate. So therefore, individuals of all ages can acquire noise-induced hearing loss. So what kind of damage could occur due to noise exposure? Well, noise exposure may cause temporary damage, permanent damage, or even acoustic trauma. In terms of temporary damage, what it could cause is swelling of the hair cells and also auditory nerve terminals. In regards to permanent damage, it could cause swelling and rupture of hair cells. It could cause distortion of hair cells, the fusion of them, and also the degeneration of the auditory nerve fibers. So now let's look at some ear anatomy. Now, the picture on the left in the first photo, we have an ear or the auditory system. Now, the auditory system breaks down into three components, okay? You have the external ear, you have the middle ear, and then you also have the inner ear. The external ear consists of the external auditory meatus or canal. We simply call it the ear canal. You have the pinna, the auricle, the earlobe, which you could see, that's exterior of the head. And then also we have the tympanic membrane, which we commonly call the eardrum, okay? The middle ear includes the smallest bones, the three smallest bones in the body, which includes the malleus, the incus, and the stapes. And the inner ear, you see that we have the semicircular canals, we have the vestibular nerve, we have the cochlear nerve, which is also called the hearing nerve, and then we have this snail-shaped structure, which we call the cochlea. Now let's talk a little bit about how sound is processed and how we hear sound. Now, what happens is sound waves travel into the ear canal until they reach the eardrum. And when the eardrum passes, what happens is the eardrum passes the vibrations through the middle ear bones or the ossicles. We call it the ossicular chain. The inner ear, as you see it, is shaped like a snail. Okay. So inside of that snail shell or inside of that cochlea, there are thousands of tiny hair cells. And so what these hair cells do is they change the vibrations of that acoustic energy into electric signals. And therefore, these electric signals are sent to the brain through the hearing nerve. Now, the brain tells you or tells us basically what we're hearing, what type of sound we're hearing, and what is the sound. Now, each hair cell has a small patch of stereocilia, which are like hair-like structures. And those hair-like structures, they stick up and out. So sound makes the stereocilia rock back and forth or in a shearing type motion. So if the sound is too loud, then those hair cells can be bent or broken. So this is the damage from noise-induced hearing loss or noise exposure. So this will cause the hair cell to die and therefore can no longer send those sound signals to the brain. So in humans, once the hair cell dies, it never grows back. Okay, so no regeneration of hair cells there. Typically, the higher frequency hair cells are most easily damaged. So people with hearing loss from loud sounds, they often have difficulty hearing high-pitched things like crickets, birds chirping, people with high-pitched voices like women and children. Now let's take a look at the second photo. Now, the second photo, like any other organ in the human body, such as like the heart, the lungs, the kidney, the cochlear, which is a highly vascular organ, and the organ of courting, requires oxygenated blood to function by way of the auditory nerve. So as I stated, just like any other major organ in the body, the organ of courting also needs oxygenated blood, and it also needs nutrients to function to allow us to hear. Now, what you see here is the inner hair cells that we talked about that are located inside of that snail-shaped like structure, or we call the cochlea. The top two photos that you see are basically normal hair cells. And so if you take a look at those normal hair cells, you can see that they look healthy, they're standing tall and in rows. Now, at the bottom, the bottom two pictures, you see damaged hair cells. And so these pictures basically shows you someone who's been exposed to very loud noise. And so this is what happened to those stereocilia or those hair-like structures. And what happens, as you can see, they're kind of bent and folded over. And so, as I stated before, and I'll continue to reiterate, once they die, they never grow back, and so, they don't do the job they're used to doing, which is sending signals to the brain again to allow us to hear. One of the common symptoms of noise-induced hearing loss is a term we call tinnitus. Some people pronounce it as tinnitus or tinnitus. And what that is basically a ringing sensation in the ear. Now, what you see here is a picture of a mobile hearing van. So with USDA grant funding, I was fortunate, or we as a team were fortunate to be able to build a mobile hearing van. And so because farmers have such busy schedules, I felt it was advantageous for us to build a mobile hearing van. And this hearing van allowed us to take the testing to the farmers. Here we have another picture of the interior of the mobile hearing van. Hopefully my mouse can point out some of the objects. So here we have on the right-hand side, we have a diagnostic audiometer, and it's simply an electronic device that we use to measure someone's hearing. Here next to it, or in front of it, we have a hearing testing booth. We ask the client or the patient or the farmer to sit inside the booth, and we measure their hearing utilizing the diagnostic audiometer. We also have some other instruments, such as high blood pressure instruments, and we also have some seating here. And with that seating, we're able to talk to the farmer and get some background information and try to learn more about, their habits and their experiences, with hearing and also blood pressure. This mobile unit has allowed us to conduct pre and post testing of hearing before and after the operation of farming equipment, along with the measuring of blood pressure and also measuring the noise intensity levels of the farm machinery, such as like tractors, combine harvesters, and also their implements. Next on the screen, you see what we call an audiogram. Now, we call an audiogram a psychometric function. So basically what it is, it's a graph. It's a graph of how well someone hears, okay? On the x-axis, you see some numbers that range from 125 all the way to 8,000 hertz. So one thing I'll tell you about the numbers on the x-axis, or just the hertz in general, is that humans have a pitch range of 20 to 20,000 hertz. Okay. Now, as audiologists, we test from 250 hertz to 8,000 hertz because there are frequencies or sounds located there that help us understand certain parts of speech. So as you see on this audiogram, you'll see certain sounds. You'll see certain letters that represent certain sounds. So like the Z, the V, the D, the M, the B. Okay. And then over to the far right of the audiogram, in the higher frequencies, you see sounds such as the F, the S, and also the TH. When we think of, so an example of this is like, let's say most men tend to have voices that fall within that lower frequency range. So anywhere from 250 to, let's say, I don't know, up to 1,000 hertz. Most women and children tend to have high pitch or high frequency voices, which fall on the far right of the audiogram. The numbers on the y-axis, they're hearing loss in terms of decibels or intensity level. So the intensity ranges from 0 to 110, 0 being the lowest, 110 being the highest, of course. And so the louder or the higher the number, the louder the intensity or the louder the sound has to be in order for this particular individual to hear the tone that we present to them. So let's take an example. So at 1,000 hertz, let's take a look at this blue line. So the blue line represents hearing loss, or their hearing level, or their level of audibility, how well they heard some of the beep tones that we presented to them during the research. So normal hearing is considered for adults on this particular audiogram from 0 to about 25 decibels. Okay. So let's just say this dotted line. Let's just imagine that it was 25. It represented 25 dB. And that means any threshold or any level of audibility or any point in time when the farmer pressed the button stating that or signaling to the tester or the audiologist that they've heard the tone, then we mark down that threshold. So anything below the dotted line will be considered hearing loss, as you can see here. Okay. So what does that mean? What this means on this particular audiogram or this particular graph is that this individual has a high frequency hearing loss. That means they're going to have difficulty hearing certain sounds, that may start in P or H or G or K or F or S or also TH. That also means that they're going to have difficulty understanding people with high-pitched voices, as I illustrated earlier, like women, children. They may have difficulty hearing television or radio, and so they may need some increased volume or amplitude. I'd also like to point out some of the familiar sounds, some items of familiar sounds. So as you can see here at 250 hertz, if we go all the way down the audiogram to about 90 decibels, you see there's a lawnmower, push lawnmower, okay? So what that's saying is that the lawnmower pushes out about 90 dB of intensity, okay, which is very loud, all right? Another example would be, let's say at 1,000 hertz, if we go all the way down to about 90 to 95 decibels, what we see is the level of a chainsaw, okay, the noise level. And one more example, at 4,000 hertz, if we go all the way down the audiogram between 95 to 110, 115, 120 decibels, then that's the noise level or the noise intensity level of a helicopter or jet engine. Just to give you an example of how loud 90 dB is and 110 decibels. Now, as audiologists, we often classify hearing loss based on its severity. So I'll give you a couple examples. One of the examples for the degree of loss or the severity is mild. So if someone presents with a mild hearing loss, then what that means is that they're going to have difficulty in understanding with understanding certain parts of speech. Their ability to understand speech, as it states here, speech discrimination. Another example would be a profound hearing loss. That means that their hearing thresholds are 90 decibels and above. And if someone has a severity of a profound hearing loss, they're going to have little understanding of speech, even if amplified, meaning even if we provide a hearing aid device to them, they're going to have a lot of difficulty understanding certain parts of speech. Now, as an audiologist, our overall goal is to increase their quality of life in regards to hearing. So we treat hearing loss with a variety of methods and a variety of techniques. But one of the most common way to treat hearing loss is with hearing aids. And so I present to you, a picture of hearing aids that are, as you notice, there are different sizes and there are different styles. If you take a look at the first picture on the left at the bottom, what we call this is an in the ear or an ITE, or in the canal, sorry. It's either an ITC or in the canal hearing aid. All of the hearing aids are custom fit. In the next picture, we have a behind the ear hearing aid. Now, the behind the ear hearing aid is not a custom fit. It goes over the ear. However, you see this, there's a plastic tube that usually connects to the hearing, behind the ear hearing aid, and it goes into the ear. There's usually an ear mold, which is a custom fit that fits in the ear. And then in the last example, you have an over the ear, what we call an over the ear hearing aid. Now we're going to shift gears. So now we're going to talk all about heart health. Now, during exposure to loud noise, the endocrine system acts as which is known or acts as a stress indicator. And what happens is it produces a hormonal changes. And so what happens is it takes the body from a stable state to an imbalanced state. Okay. And when that occurs, it increases the heart rate, blood pressure, and also releases stress hormones. Now, some of the common causes of high blood pressure are unhealthy diet, which could consist of a high sodium diet. It could be physical inactivity. It could be too much use of alcohol and tobacco, and also a family history. Now, according to the South Carolina Department of Health and Environmental Control, about 1 in 3 of South Carolinians have high blood pressure, also known as hypertension. And they also stated that thousands more of South Carolinians have high blood pressure and don't even know it. Now, as we can see here on this map of the prevalence of hypertension among adults, this was taken from data from the South Carolina DHEC between the years of 2014 and 2016. So if you look at all the dark states, you could notice that the prevalence of hypertension is significantly higher. So counties such as Orangeburg, Barnwell, Bamberg, Collins County, Allendale, Williamsburg, Georgetown, Marion, Dillon, Marlboro, Darlington and Lee County, Union and Chester, Lawrence, Abbeville, and also McCormick. So, even if you do not reside in these areas with significantly higher prevalence of hypertension, you still need to have your blood pressure checked regularly by your physician. Now, in regards to African Americans, in 2016, the United States, approximately 76,000 African Americans died from heart disease. Heart disease in 2017 in South Carolina alone was a leading cause of death. In 2017, 2,739 African Americans died from heart disease. African Americans face a higher risk of stroke deaths. And in 2017, heart disease accounted for approximately 16,000 hospitalizations, with a total hospitalization charge of more than $940 million. So South Carolina is considered to be in the stroke belt. As we know, the stroke belt has the highest amount of strokes in the nation. So here we have a picture of some of the complications of hypertension or high blood pressure. If you take a look at on the left side, you see a normal vessel with an unobstructed flow. However, on the right side, you can see where there's blood vessel damage. Uncontrolled high blood pressure will and can lead to a stroke, and with the damaging and weakening of the brain blood vessel, causing them to rupture, to narrow, and also to leak. High blood pressure, it causes clots which form in the arteries, which will lead to the brain, blocking blood flow, and also potentially causing a stroke, which is something we definitely, like to avoid. In regards to stroke deaths, if you notice, between the years of 2007 and 2016, the rate per 100,000 population was about 53.3 for South Carolina. And as you can see, there was a decrease from 53.3 to 45.5, which is higher than the U.S. average in 2007 and also in the year of 2016. Here we have the blood pressure categories. They range from normal to elevated to high blood pressure stage 1, stage 2, and also the hypertensive crisis. So, a few facts to kind of be aware of as we take a look at this figure, this picture. Many individuals, as we stated, with high blood pressure don't even know that they have it, and so oftentimes the signs and symptoms are misunderstood. High blood pressure develops slowly over time, and can be related to many causes, in which we named a few earlier. It has been known to not be cured, however, but it can be managed effectively through lifestyle changes, when needed, and of course, medication. Now, if we take a look at this chart for normal, the systolic values, or the upper number, should be less than 120 millimeters, and the diastolic values should be less than 80 millimeters. Permissible noise exposure. If we take a look at the picture on the far left side, what you'll notice, if we take a look at the ATV and push motor, the noise level of 90 decibels, we've already taken a look at the audiogram, and we have a general sense of how loud or how intense 90 decibels is. So the maximum safe time at 90 dB without wearing hearing protection devices is 2.5 hours. Okay. To bring it full circle, if we take a look at the second one with the tractor and combine with a cab, such as a grain auger, at a noise level of 92 decibels, the maximum safe time is an hour and a half without wearing hearing protection devices. And if we go further down, the third one from the bottom, a tractor with no cab, a grain dryer, the noise level of 105 decibels, but the maximum safe time would be about 4 minutes. And so as we visited the farmers, the one thing I noticed is that some farmers had tractors with a cab, and many of them had tractors without a cab. So at 1.5 hours with the cab, with no hearing protection devices, in contrast to a tractor with no cab, 4 minutes is what we noticed. So some of the other limits for permissible noise exposure, and the second picture, according to OSHA, with hearing protection devices, 8 hours, 90 decibels. Okay, so it means they're allowed to operate that piece of equipment for no more than 8 hours at an intensity level of 90 decibels. And for those of you who don't know, OSHA stands for the Occupational Safety and also Health Administration. Okay, now we're going to switch gears again. We're going to talk about the farmers. So here we have some participants' baseline for the diastolic blood pressure versus the decibels and noise. If we remember correctly that the diastolic blood pressure or value should be less than 80 millimeters for it to be considered normal, and that's the bottom number. We notice in the green, for this is just a small sample, but if we notice the green is at 88.7 decibels, and so we recall from the previous two slides, we'll notice that this noise level is similar to an ATV or a push lawnmower. If we take a look at the blue, we'll see that the normal diastolic values should be less than 80 millimeters. And so what we notice is that in sample 4 and 5, that they were indeed lower than normal, as the green, which is the noise level, increased from 88.7 decibels to 104.8 decibels. However, if we look at sample 2 and 3, we notice something slightly different. We notice that there is an elevation in the diastolic blood pressure values as the intensity of the noise level increase. So in a couple of instances, the diagnostic, diastolic number has no significant change in intensity of noise as the intensity of noise gets louder, in contrast to those who presented with elevated diastolic values as the intensity increased. If we take a look at this one, this is the participant's baseline for the systolic blood pressure, which is the top number. And if you recall that the normal is considered less than 100 millimeters, which is the top number. So if we take a look at these colors of this chart, orange at 88.7, orange is the noise level, blue is the systolic or upper value. So orange was 88.7 decibels, like the noise level of an ATV or push lawnmower, as we stated earlier. And then the blue represents the systolic upper value. So in sample 5, we saw that the systolic level was 127, which we know is 7 points higher than the normal systolic blood pressure, which should be for normal should be less than 120. And so as we take a look at this, the question becomes, why does the blood pressure values increase with the increase of excessive noise exposure in some, but not others? So it is because of this phenomenon that further experimental investigations is needed to determine the relationship between these two variables. So as you can see, it is important to wear hearing protection to prevent hair cell damage and other health related issues. So, as we stated earlier, remember that, these cells do not regenerate or grow back when damaged in humans. We have there are different types of hearing protective devices, as you can see on the picture that's illustrated in front of you. Earplugs and earmuffs, they tend to help reduce exposure by providing protection against hearing loss. And so earplugs tend to provide the greatest amount of protection as long as they're inserted properly. Therefore, these individuals need to be trained to wear them correctly when they're used. And earmuffs can also reduce the decibel exposure. So, though not to the extent that earplugs can, however, they're easier to wear correctly, which is why some people prefer them. And for a bit of added protection, it is commonplace to see individuals wear the disposable earplugs, which you see the green ones, along with earmuffs as well. Just give them that added protection. On the right side, there's a picture here that kind of shows how to properly insert, some insertion techniques for insertion of the earplug. And so as you can see here in step 1, simply roll the earplug into a tight cylinder. Step 2, gently pull the ear upward to straighten the canal. And then in step 3, insert the earplug well into the ear canal and hold it for about 30 to 60 seconds. And what will take place there is it would essentially take the shape of the ear canal. And as you can see in step 4, obviously there's an improper fitting of the earplug, and if that's the case, then of course it won't be as effective as it should be. So you may be asking yourself, how do I select a hearing protection device? So first of all, you need to know the NRR, or the noise reduction rating. Um, so Noise reduction rating is just simply a unit of measurement used to determine the effectiveness of the hearing protection device to decrease sound exposure within a given work environment. So obviously, the first consideration would be determining whether it would block enough sound to reduce exposure, at a safe level. The higher the NRR, the better. The NRR can range, or the range can vary actually, depending on the manufacturer of the product. And they can also be purchased like online, at local pharmacies, and most major retailers. The second thing to consider is to consider the work site, and also the job tasks. The third is to decide what's most comfortable, and also what's most convenient. So the takeaway for me from this project was that without healthy farmers, we would not have safe food to consume, and therefore life would not be sustainable in this country. So I'd like to acknowledge the USDA, the United States Department of Agriculture, and the National Institute of Food and Agriculture, and also 1890 Research and Extension Program. That concludes the webinar. Are there any questions?
Thank you, Dr. Bush. Enjoyed your presentation. We do have question, or I see a question just popped into the chat box. So if you have any questions for Dr. Bush, please feel free to drop your questions in the chat feature. And if you look on your screen, generally towards the bottom, you will see a little bubble that says chat. And so if you just click on that and drop your question in there, I will gladly ask your question to Dr. Bush. So first question is, do you think that research will develop a way for the regrowth or repair of the hair cells?
Yes, I do. Actually, currently there's research out there in which they're looking at how mammals are able to regenerate hair cells, and also with the inclusion in terms of in regards to human, they're looking at the stem cells and how they're able to regenerate hair cells. So yes, I do think that research is it's moving, and it's moving swiftly.
Okay. Is there any specific hearing aid that is considered better based on the example of over the ear, in the ear, and other options or alternatives?
Yeah, that's a very good question. Basically, as an audiologist, we fit patients based on their needs, and so it would be based on the severity of the hearing loss. How much amplification that they need, what type of hearing loss, if they have a nerve-related hearing loss, or if it's a conductive hearing loss where there's blockage in the middle ear, or the outer ear, and so it's on a case-by-case basis. Most hearing aids, I give the analogy of a car. So it's the purpose of a car is to kind of get you from A to B, whether you like a Cadillac or a hybrid. It's totally up to you. They do range in price from perhaps maybe $2,500 to $10,000. So it's kind of it's a case by case basis, and it just depends on the patient's needs.
Do farmers usually wear the hearing protection? And did they know their numbers for hearing blood pressure before you went out to get their numbers?
That's a good question. I think most of the farmers knew their blood pressure numbers prior to us going out. Because they attended doctor's appointment on a regular basis. In regards to hearing, some of them had not had the hearing tested in a very long time. However, I did conduct a survey to kind of figure out, to determine, for example, what was the usage rate of the protection devices. And so I recall, I believe it was like 50% of the 50% of the participants responded that they did not use hearing protection devices, whereas 44% of them said yes. Also asked questions regarding like the consideration of using protective devices. 78% of them said yes, while 22% of them said no. Also asked questions regarding, you know, if they're engaged in like noise exposure training or education. 60% of the, I think 67% of them said yes, and 33% of them said no. And then also, asked them if they found they would benefit from noise exposure training or education or noise-induced hearing loss or hearing conservation. And 89% of them said yes, and 11% of them said no.
Here's a question. How long can you run a chainsaw with hearing protection?
With hearing protection, I think it was, I mean, with hearing protection, it's at about 80 or 90 decibels. I guess about less than 8 hours.
Does the research project offer assistance with hearing aids for participants?
Hearing aids or hearing protection devices. So hearing aids.
Hearing aids.
Hearing aids. No, hearing aids. No, hearing aids are in most cases. Hearing aid is one of those things. It's kind of like eyeglasses. With hearing aids, the patient would have to purchase those. However, the project did provide hearing protection devices, ear muffs, and also disposable earplugs.
And that person said, "Thank you very much."
Welcome.
Would you prefer using earmuffs over earplugs as a precaution of damaging your eardrums by inserting the plugs too far into the ears?
But what happens is if it's inserted properly, it'll, like I said, once you follow the directions of the package, in most cases, the packages come with directions on how to properly insert it. And so if the individual follow the directions, they shouldn't have any difficulty in putting it too far down. And so I believe the outer 1/3 of the ear canal is made of just simply skin and bone, and on the inner 1/3, that's where you have some of your pain sensors. So at some point in time, they'll stop inserting that earplug.
So this is a follow-up question to that.
Mhm.
So a lot of times people, of course, are now wearing, well, a lot of people wear the earbuds or the wireless
Mhm.
earbuds. Um, how does that impact one's hearing?
Well, it can impact one's hearing. It kind of depends on the setting. Oftentimes, you see individuals who are, wearing earbuds or headphones when they're exercising, or if they're more on the lawn. And the only problem with that is typically they're competing with the noise of the equipment that they're utilizing. And so what happens is they're trying to hear the music while trying to block out, the external noise. And so essentially what happens is they end up increasing the intensity or increasing the volume of the music, let's say, that they're listening to, and so potentially impacting their hearing or causing damage to their hearing. And what they would do is probably cause a temporary threshold shift where they have a temporary change in hearing.
How long can you be exposed to loud music in a confined space and it result in hearing loss?
Well, it won't cause permanent hearing loss, but it definitely will cause a temporary hearing loss. So we call it a temporary threshold shift. And so, that could be a matter of, 30 minutes, just depending on the intensity. So, the higher the intensity, the quicker the damage is caused.
Okay. And this is another earbud question. So are there certain earbuds that you would recommend for a person who enjoys listening to, music or, listening to books, or is it just the volume that matters in that case?
In that case, it just depends on the volume. It's just like, as we stated before, the different styles of hearing aids or the different styles of hearing protection devices. It's just what's convenient, what's comfortable for you. But in the what's mostly important is the intensity. And so, as we stated, throughout the presentation, the exposure to high levels of noise over a certain period of time, whether it be short or long duration of time, will have an impact on hearing. Well, hey, I want to thank everyone for joining us today and listening to this webinar. I hope you gained some valuable information, which you can pass on to your family, your loved ones, your friends, and any farmers in your community.
We do have a request for your contact information.
Oh, perfect. Oh, yeah, that's hold on. I think that's on the last slide here. Let me get it here. All right, there you go. Contact information right there.
Mm-hmm.
Has my email address and also my office phone number.
Awesome. Well, if you oh, wait a minute. There's one more question. How often does the mobile hearing van, I think that's the correct word, go out? And are you required to schedule an appointment?
Yes, we try to schedule an appointment with the farmers. As I said, they have busy lives and so we try to schedule with them. And so we go out on a case by case basis so that we preserve our resources. And so yeah, we try to go out as much as possible. However, with the pandemic that has occurred, we've been limited in what we can do at this time.
And the $1 million question, Dr. Bush, someone's asking is, are the hearing tests free?
So yeah, this is a baseline hearing test. So it's not a full diagnostic evaluation, but yeah, the for the participants of the program, correct. Yeah, it is free for them.
Awesome. And so I just had another question. For agricultural workers, would you suggest that with their regular medical routine, that they should get their hearing tested every year, or what's your recommendation?
Yeah, absolutely. As we age, probably starting at the age of 21, we begin to lose some functionality, so a lot of times with our hearing. And so that's, one of the things that we definitely stress to our patients is that, they should have when they going in to see their primary care physician or the internal medicine physician, we ask them to have them take a look in the ears. And, if they have any issues with hearing, to try to address that at that appointment. So yes, so typically an annual evaluation would definitely be warranted as we get older.
Okay. And does OSHA have any regulations pertaining to reducing hearing loss? I mean, I know that it kind of, it manages occupational risks. So is that something that they look at or mandate that ag workers wear those devices?
Yes, the Occupational Safety and Health Administration, along with the National Institute of Occupational Safety and Health, they do, try to regulate it as best as possible and put out information to, preserve or to help keep the workers safe.
Okay. Well, all right. Any other questions? One more question. So are farmers the only ones that have access to testing?
We do have a clinic on campus. The South Carolina State University Speech and Hearing Clinic on campus, in which we provide services to individuals who are in need of speech services, or speech and language services, and also hearing testing.
Yes, we do have a phenomenal speech. What is it? Speech, language, and hearing?
Speech pathology and audiology.
Speech pathology, yeah. Thank you for that. Okay. Well, Dr. Bush, again, we thank you so much for accepting our invitation to present to us your research. It's definitely informative, especially for the nerd in me. I learned a lot of new things, and I have a 5-year-old who's now into tablets and wanting to use earbuds. So I'll be more cautious about his use of those devices. So again, thank you so much, and I thank everyone else for joining us. Um, we will have more information out available on our next webinar next month. If you have any questions about 1890 research and extension, as I mentioned at the top of the hour, we provide programs and services to South Carolinians. We have 5 offices across the state. So each of our offices provides programming to constituents in their areas, and they're very specific to the needs of the community. So definitely, if you have any questions, please feel free to go on our website or on the university's website. So it's sesu.edu/1890. And you can also find us on social media, Facebook, Instagram, Twitter. Our handle is SC State 1890, all one word. Thank you so much. And you all have a great day and continue to stay safe.